When we're looking for signs of suicide, it's really important to remember that hindsight is always 20/20. So if you or someone you know has lost someone to suicide, it's much easier to recognize these signs after the fact than in the moment. And this is because people who experience suicidal ideation often feel like their experiences are burdensome, and so they don't want to put that on somebody else. And so they explicitly try to hide that information, which means these warning signs can be incredibly small and difficult to detect. But that also means that if you do notice a sign, you might be the only one who did, so it's even more important for you to reach out to that person and talk to them about what you've been noticing.
Suicide warning signs fall into three major categories: talk, behavior, and mood. When we talk about how people talk about suicide, it could be a number of things. People can joke about suicide or joke about their depression symptoms and how bad they are. They can feel burdened to go to their family, and so they don't want to talk about it, or they'll say things along those lines, such as, well, I don't want to dish all my problems onto you. I don't want you to also feel this burden that I'm going through. They could say things like, I wonder what it would be like if I was no longer around, or how different life would be for my family if I just wasn't here.
When we're looking for behavioral warning signs, we want to look for things that are out of the norm for that person. This could be extreme fatigue or sudden insomnia that's not normal for that individual. This could be increased use of drugs or alcohol. It could be engagement in risky behaviors. This could also be things like giving away their possessions, almost as a way of willing away the things that are important to them before they're gone.
Mood-focused warning signs could be anything out of that person's norm. Maybe they're increasingly angry or sad or apathetic towards things that they were typically really happy about. Things can be like hanging out with friends and they're just not really into going out, or maybe they're hanging out in their room a lot and they're not coming downstairs. Some of these behaviors and moods that they can feel can change rapidly too, so that's something to really pay attention to. Maybe they're really angry and then the next day they're happy or engaged more, and that could be indicative of someone who's already made a suicide plan. And so these mood shifts are something that you should pay attention to and just check in with that person to make sure that they're doing okay.
If you notice any of these warning signs, please reach out to the person. Have a conversation with them about the things that you've noticed, ask about what might be going on in their life, and help them find support if they need it.